All right. Well, looks like we have the cue now to start. Good afternoon, everyone. I'm Mary Dolansky, the Sarah C. Hirsh Professor at the Francis Payne Bolton School of Nursing at Case Western Reserve University, and I'm also co-director of the VA Quality Scholars Program. And then I also chair or co-chair the Clinical Translational Science Collaborative Workforce Development Module. And I'm very excited to moderate today. This is the third Fireside Chat for the Clinical Translational Science Collaborative Fireside Chats with Leading Ladies series. Today, our focus is on nursing. Now, before we convene with our panelists, I'd just like to share a little bit about the Clinical Translational Science Collaborative, better known as the CTSC of Northern Ohio. This is a collaborative among Case Western Reserve University and its affiliated hospital systems, including the Cleveland Clinic, MetroHealth, University Hospitals, and the Lewis Stokes Veterans Administration Medical Center, and the Northeast Ohio Medical University, and the University of Toledo. So the CTSC aspires to be a catalyst for high-quality clinical and translational science and transformative research to positively impact the health of those in Northern Ohio and beyond. So today, we're going to gain insights and wisdom and support that is provided by our nursing leaders in healthcare operations, in our education, and in our research across our region. And so we will start with some introductions, and we will have each speaker on our panel just do a quick introduction. And first, we'll start with Dean Carol Musil.
Hi, everyone. Thanks for joining. I'm Carol Musil, Dean of the Francis Payne Bolton School of Nursing.
Okay, great. Thank you, Dean Musil. And then we'll go to Dr. Edmiston from the VA.
Hi, everyone. My name is Beth Edmiston. I am the Chief Nurse Scientist for Northeast Ohio VA Healthcare System.
Excellent. Dr. Kline.
Hi, everyone. I'm Melissa Kline. I'm the System Chief Nurse Executive at the MetroHealth System.
Great. Meredith Foxx.
Good afternoon, everyone. Meredith Foxx, the Executive Chief Nursing Officer for the Cleveland Clinic Health System.
Great. And last but not least, Dr. Ma.
Hello, I'm Holly Ma. I'm the Vice President of Nursing Professional Development and Practice and Research at University Hospitals.
Great. Well, thank you all for being here today. You are truly nurse leaders, and we are delighted to learn a little bit more about you in this fireside chat today. And I'll just kind of start out with a little bit of get to know you all. And I think all leaders start with some childhood stories of maybe where you would want to be or what you envisioned you would be when you grew up. Can you share a little bit about some, childhood memories about sort of how your career aligns? And feel free, I don't know, jump in. Maybe Dean Musil, would you start us off?
Happy to do so. I, as a kid, was interested. I read a lot of biographies as a kid. And I was really interested in science. And what I was very much interested in was becoming a scientist. And I was quite taken with Marie Curie's story. And one of the things I really liked about her story was that she was able to not only do science, but she was a mom and she could work at home. And so she could still take care of her kids. But so what I wanted to be as a kid was a scientist. And, I went through the phases of wanting to be a geologist and an anthropologist and even an astronaut. But ultimately, and the other thing I was good at was writing. So ultimately, I found my way to becoming a nurse and a nurse scientist. So I feel like I found my place in the world.
Interesting. Yeah, nice story. How about you, Meredith?
So I feel it's slightly cliche because my aspirations were a nurse or a teacher, and so the traditional kind of female occupations for some decades. But they're, where I've ended up are kind of non-traditional, right? We need strong nurse leaders, we need strong women leaders in healthcare, and I always loved math and science. And then the other thing I would always say is that I really did always, I was a babysitter and, taught summer camps and all that, and camp counselors. And so really enjoyed spending time with children. So I think that's where the nurse teacher came. And my background is pediatrics, so I was able to marry both worlds at But I do sometimes think about that from the female perspective of, we're trying to expand, women in all types of different careers and different types of industries, and but we still need lots of nurses. So, but again, nurse or teacher, and here I am.
Okay, great. That's a neat story. Thank you for sharing that. How about you, Beth?
When I was a child and into high school, I really wanted to be a veterinarian. And then I love animals, and then I went to shadow as like part of a school program, and I was able to shadow like a surgery on a dog, and I at that point was like, absolutely not, I'll never do this. Like but when I reflect on that, I was reflecting on that over this question. I was like, so funny, because I became a nurse, but I never was interested in doing like surgical nursing. I always stayed in the medicine realm. And I think part of that is because that is just something that I never wanted to do. I'm more of like a thinker than like I'm not into like doing procedures, this sort of thing. So yeah, that was my childhood dream. But.
Neat. Yeah. And how about you, Holly?
Well, like Dean Musil, I also had an affinity to Marie Curie growing up, but that's not the reason why I ended up where I am today. Unfortunately, growing up, my father had a lot of health issues, and I didn't always understand what was going on. But I remember at one point, I was about 7, and I had stayed home with my mom, and I'd been ill that day from school. And my dad was home and did not feel well, and he had gotten up, and he ended up having a seizure and falling over and hitting his head. And we lived in the country. This is back in the day, so 911 didn't exist. And she told me immediately, run and get Terry. And Terry was our closest neighbor who happened to be a nurse. And so Terry was working nights. I obviously woke her up in the middle of the day, and she immediately, without hesitation, no shoes on, nothing, no coat, just runs to our house, and I follow her. And I don't remember what all she did, but I do remember with her being there, I felt like everything's going to be okay. I felt safe, I felt calm, and I realized that's what I want to do when I grow up. I want to be able to provide that for other people.
Nice story. Great. How about you, Melissa?
Sure. So my story's a little similar to Beth's in that I thought I wanted to be a veterinarian. I really love animals also. And I was kind of on that path. I loved math and science, and had shadowed a vet, and I loved it. Was looking forward, and was excited to, rescue lots of animals and have them at my house and stuff. But then I got to high school, and I don't know what really changed exactly. I was very close with my aunt, and she was a nurse, and she actually worked here at MetroHealth at that time, and had interviewed to be in the flight program. We were starting our flight program at that time. And she was deciding between that and the anesthesia school, and ended up going to anesthesia school. And I just thought, wow, that's really neat. Like sounds like there's a lot of different things to do in nursing. And so I went down that path and went to nursing school.
Wow, it's really neat. Really fun to hear your stories about sort of your childhood dreams and your interests, and then how that led you to maybe some mentors. And that you then kind of took this path of nursing, seems passionately directed, and then kind of kept on going. So that makes me think a little bit about the power of being a nurse. And Rossi Williams, an American nurse and attorney, once said, to do what nobody else will do in a way that nobody else can, in spite of all we go through, is to be a nurse. So this quote that reflects the power of being a nurse makes me think about how important it is to be led kind of by your why. So what is your why in sustaining you in this work of a nurse leader, and how does that influence this why, your work? So we could go the same pattern again. Maybe Carol, if you could start.
Sure, happy to do so. This was such an interesting question. And for me, I think back to my second quarter in college and University of Cincinnati. And we had a course then in nursing theory. And we had Imogene King was the theorist that our school used. And we read a number of articles and books about the transformative nature of the nurse-patient relationship and this broader ideal about what nursing is. And it was the first time I had thought about nursing at that kind of a conceptual level. And it was so impactful to me that during the times when I was struggling and not a very good med-surg nurse, I would think about what it was that Imogene King spoke about in terms of this nurse-patient relationship, helping patients, transforming them. That kept me going. And it still is probably my guiding star for what is nursing.
Meredith, what are your thoughts on your why? What drives your?
So we know obviously there's so many different attributes that people, coincide nurses and nurse professionals with. We know one of them is obviously helping others when I am advancing the care and health of others. I think where I found my why is advancing the nurses and the professional nurses I work with to advance that. So, my why and my passion is around supporting the nurses to do that. And still putting the patient at the center, but I find, obviously, I think, how I've ended up in leadership has been because I want to support those nurses, whether it's mentoring them, adding to their knowledge base, adding to their skill set, adding to their confidence. But that is where I find the why. So ultimately helping people to help our patients and our communities.
Yeah, great. How about you, Beth?
I guess I was thinking about this sort of in two pots, so to speak. So as a nurse, I always felt, even through school, even when I decided to become a nurse, which was sort of after seeing just tons of footage about Hurricane Katrina. That was while I was an undergrad. But just being the advocate for somebody, being that advocate for people that don't have a voice because they're intubated or because they don't understand what's going on, or maybe because as a nurse, I would have the knowledge that maybe something wasn't happening for that patient that needed to happen, or vice versa. And as a nurse, you're the last person between the patient and the system. And so you need to be standing in between that patient at their door, advocating for what they need to do, or what they need. But then as a nurse researcher or nurse scientist, it's a little bit different for me. Not that I'm not advocating for patients, but I do think we need to advocate for better processes, better workforce development. We need new and refined knowledge. We have to implement that knowledge into practice. We shouldn't have to wait 17 years or 20 years on the average from getting the traditional research to the bedside, to how we get it into practice. Just to improve our current processes. So I just think, like, the more complex health becomes, the more complex our solutions have to become. And so I guess leading that change, and maybe that is sort of like an advocacy still, like trying to advocate for those better processes and better work for the nurse.
Nice. Thanks, Holly.
It all comes down to me is making a difference in people's lives. And I think it was when you're a nurse and you're at the bedside, that is easy to see what difference you're making. As your career changes and evolves and you are farther away from the bedside, you have to figure out, how are you doing that? And I think for myself, I infuse that in my work through, how do I empower employees to do the best job they can, to perhaps go back to school, become a nurse if they're not a nurse, go back to graduate school, what have you. And so I think it all comes down to, how can I make a difference in people's lives? And ultimately, when those things happen and those people are able to perform at their best, then that translates to our patients.
Great. And Melissa.
Yeah, I think I echo everything everyone said. It's Rusty, the last person. But I really enjoy helping our nurses find their passion. So you might start off in med surg and maybe that's not what you love. What is it that you do love? What are those aspects about med surg that you do like? How can we help you find that next step or that next path in your career, whether it's returning to school, transferring to another department, taking on a different type of role away from the bedside. I like helping our nurses excel at what they're good at.
Yeah. So these are really great whys. And it's sort of helping or giving me an opportunity to reflect about sort of like my childhood, how I got into nursing and my why. And I'm hoping that people who are attending today are kind of thinking about this also in their work forward. I'm also wondering if you can share with us, because you're all such awesome leaders, and if you could share with the people here today, maybe what was your most proudest moment in your career? So how did you then take your why and then manifest it? What can you share with us as to your proud moment?
That's such an interesting question. And I think when I reflected on it, it seemed that I wanted to mention that there really have been 3 phases to my career, and each of those phases has been the best. I spent a number of years as a psych liaison clinical nurse specialist, which was really the best job in the world. And then I became a faculty member and did a lot of research, and that was the best job in the world. And now I'm the dean of such a fabulous school of nursing, and that's the best job of the world. So, the opportunity to touch lives, excuse me, and help people to, as the others have said, to find their place in the world. The fact that nursing is so vast and there's a place for everyone. People just need to find where they're going to excel.
Similar, I think, at different points in my career, that the best job, right? As Carol just said, I love being a clinical nurse specialist. I think the true sense of a pediatric clinical nurse specialist, probably one of my favorite roles I ever had, and the ability to change practice, to drive nurses into certification, to quality improvement, to wanting to do research. I think was very fulfilling. But then you think of like going into leadership. I had a tremendous opportunity to elevate advanced practice nursing here at the Cleveland Clinic and create a formal advanced practice leadership structure and governance. Where that was, kind of groundbreaking at the time, and people coming to us to, how did you get buy-in? How did you get that support to have practice providers be elevated to leaders and be managing their teams and be viewed in that way across the organization, not just in pockets. And so then, that felt great. And then to think about being asked to take on, an executive leadership role during the biggest pandemic of any of my careers, like to be held that trust that I can lead from that perspective during a time when, there were so many uncertainties and unknowns. And so those are the couple of things I would say. But even just on, I don't want to say smaller scale because I think it's impactful, is that going back to my first example of being a clinical nurse specialist. And for those of us, if you are a clinical nurse specialist or the challenges with being the CNS, it's a role that's had its ups and downs, right? It's been respected, it's been valued, and then it goes through phases where, do we need them? Do we not need them? Hopefully we're on an upswing of everyone recognizing the value again, and there's some great work going on in different pockets. But I recently had the opportunity to mentor a staff nurse, and she's a med-surg staff nurse, and she didn't know much about clinical nurse specialists, and she was struggling with what she wanted to do next. And she's definitely someone who needs to continue her education, needs to continue her career growth. And once we started talking about it, and I didn't want to influence her and say you should consider this, I made her go out and research it. And she's now going to graduate in December with her CNS. And not only that, she's now paid it forward and has now written letters of recommendation for 2 more staff nurses to become a clinical nurse specialist, so in clinical nurse specialist program. And I think to me that was a huge value because the staff nurse is seeing the value of that role and understanding that there's lots of opportunities within nursing to impact practice within an organization. So, and she texted me that this morning, my mentee. She's like, look, I just wrote a recommendation for another staff nurse to go to CNS That means a problem.
That's it. That's nice. Great story. Beth? Mm-hmm.
I was thinking about this because I think I'm just very proud of myself. Just to see where I've come in the last, few years, since Mary. I actually was asking this question to my husband last night to see if he could come up with a different answer than me, but he came up with the same answer. But just completing my PhD, was basically, I'm still like very proud of myself for being able to do that. I got married and had 2 kids during it. Actually, I should say the one kid came out 3 weeks after I defended my dissertation. And then also during my PhD, my husband, he did his undergrad. So I was like, the primary breadwinner, like working while doing my PhD, anyway, so it was just like, I don't know how I got through it, but I did.
Right.
So yeah, that's
Oh, that's a good story. I mean, it's really your leaders because of your determination and your characters and the fact that you can get through these moments to step you to the next level. So that's a great story. Holly?
I think mine's fairly similar to Beth's, but a little different twist of the fact that I'm the first nurse in my family. I am also the first female to get a graduate level degree. I'm also first female to have a formal leadership role in my family. And so I think what makes me proud is seeing my mom and her looking at me and seeing me being able to do things that she probably thinks she could never do. I think she totally could have if she wanted to pursue it back then, but I think that makes me really proud to know that I'm being a pillar for other females in my family now, and can lead that way of you can do things, you can do tough things, you can do tough things while having a family and working full time as well, and you can accomplish it, and it's possible. And so I think that's what I would say.
Great. Thank you, Holly.
I think for me, what I'm most proud of is just seeing the successes of people that I've precepted or hired when I was a nurse manager or even a director, seeing their success in the organization and seeing them happy and fulfilled, doing what they love and excelling at it, and really being a role model for others within the organization. I've had the pleasure of seeing a couple people that have worked for me go on to have more influence across the organization. So one became the head of infection prevention, and was instrumental during COVID and really helped lead us through that time. And to think back that she worked for me as a staff nurse was just amazing. Like back then, we never would have thought we would be in the positions that we are now. But they just kind of came along and you take advantage of that and we work towards that. But I think we're all pretty humble about it as nurses and probably as women, and we don't realize what huge roles we do have, and that people are looking from the outside going, wow, look at that, look at what they're doing. So that's what makes me
Yeah, great. Well, these are such great stories. It's been heartwarming to hear your stories as, women leaders, especially during Women's History Month, which we're in now, and to hear and learn a little bit about you all so that we can see the factors or what it takes to build a leader. And I think that what I've kind of gleaned from this is it's really in all of us, we all have this potential to be leaders. A lot of our stories are similar. And it's just a great profession for us to be in nursing. I hear that loud and clear through your stories. So now I'm just going to move us a little bit from our personal stories to a little bit more on your work as a leader in supporting research, and maybe ways that you have used research in your careers, or maybe ways that you support research in your current work and how you help lead the academic, I guess, our engine of accelerating research, through our clinical translational science collaborative in all of our areas and departments. So Dean Carol Musil, maybe you could start us off again. Thank you.
Many of you know that when I transitioned from being a clinical nurse specialist, I did a postdoc, and then I spent probably almost 30 years of my life doing research as and most of it externally funded during that time. And I still am on a couple research projects. So, I love research. That's what I always wanted to do. And so for me, what is fabulous is that now I am in a position to help other people do research, to find faculty members who are at various stages in their career, but identifying people, providing support to people who are going to be successful in a research career. There is so much need for understanding what helps individuals get better, and for nursing research. And so I'm just really, happy to have the opportunity. And the other thing I'll say too is we have really benefited from the CTSC because we have been able to hire a number of faculty members who have, I guess, graduated from the CTSC. And then, in addition to, externally funded research, that may not have direct immediate application. We have this large cadre of DNP prepared faculty, and we're doing a lot with, obviously preparing DNP prepared nurses who then go out and provide leadership and infuse the ability to look at particularly, quality and improvement kinds of activities in their institutions. So I feel like I've contributed in that realm significantly.
Yeah. Yeah, I think it's highlighting our academic clinical partnerships really, and that we really have to align. And so honored to have you all here from the clinic, the VA, UH, and MetroHealth, really to, kind of exemplify this partnership and the teamwork that is really required to move this, specific area forward. So Meredith.
So coming from the lens of being on the practice side or the clinical side or versus the academic side, I think, I've been blessed in my career here at the Cleveland Clinic. And for those of you that don't know Nancy Albert, we've been blessed to have Nancy Albert as our Associate Chief Nursing Officer of Research and Innovation, who literally is internationally known for her research and her publications. I always tell people her CV, she didn't, even if she keeps it with the last year publications, it's probably still, 25, 30 plus pages. It's probably volumes by this point. But, she is so passionate about nursing research and ensuring that nurses are at the table to be part of research, not only supporting our bedside nurses through projects and questions and being principal investigators, part of projects, but really taking it all the way to the publishing phase. And she does not give up on people from start to finish. And that's been supported from the organization standpoint for many years. She was our first associate chief nursing officer. And we've seen practice change. So we've had many things that over the years that have been ideas from the bedside nurses that have gone to research that have gone through significant practice changes, which is pretty exciting, I think, for nurses to see how they impact the translation from research to practice. Candidly, through the pandemic, we saw an increase in people with innovations and ideas, but then taking those to fruition kind of slowed down a little bit because of the demands on patient care and the burnout and stress related to all of that. And we're seeing an uptick now, and we have nurses that are more passionate about it. And I think it's because we have great role models that can walk them through the process and see it not as a challenge, but something that we should be expected to do. I only wish we had more. And I also think, I share this example to a lot of our staff nurses, our bedside nurses, that we have many of our physician colleagues that do this so well, and they're very inclusive of everyone together, and you know, especially when they get to the publishing part, which I think we need to be more recognize that not as you know, we don't have the time to do that. That should be an expectation of our time, and that we get in front of it and get out there and publish. And I attribute to two physician colleagues during the pandemic that said, Meredith, we want you to be an author with us on this. Please just write 2 paragraphs. We're not asking you to write 10 pages. We're asking you to write 2 paragraphs. And, you know, I think we as nurses, as a profession, should do more of that, because then, you know, we'd be out there more publishing it. And I thought a lot about that. So trying to just think of different ways to ask a few nurses to write down a few sentences and get this, you know, let's get this going. And so I think we need to do more of that teamwork to have the bedside nurses and our clinically practicing nurses involved in that.
That's great. I love that point, bringing the bedside nurses, you know, more into the research and the publication, providing them a little bit of time to do that. So that's great. Beth, any thoughts?
Yeah, piggybacking off of what Meredith was saying, I'm new in this position. I started last year. So, this first couple of years, I'm just trying to focus on like promoting project culture here, like whether it be a research project or a QI project or an EVP. I think it's really important for nurses to get involved, further their professional career, publish, submit an abstract. So setting up, VA has a lot of infrastructure that's easily used to promote, excuse me, these sort of things, right? To make things easier for them. So for nurses. So one of the programs I started here is called QI Nurse. I have 41 bedside or operational nurses that have already signed up, and some more coming. And so we're getting them education, they'll do a project, and then the idea is to really promote these like project champions on the unit. And we're going to do a similar program for research projects, which are, you know, just as far as research being what it is, it's just the process is a little bit more taxing, I guess, to say, or like, you know, going through the IRB, writing an official proposal, et cetera. So, but yeah, I think it's you know, getting people involved and trying to show them the value of doing these, so to speak, extra things, even though we don't see them as extra, but you know, not just taking care of patients.
Mhm.
So I would say very similar to what's already been said. I would say just to add I think always asking the question when people are looking at a policy or asking about a practice is, what does the evidence show? Are there studies out there? You always have to keep bringing that up in conversation. Oh, well, I don't know. Well, then, okay, this is how you get access. Here's the librarian. This is, you know, how you can go about finding out information. Let me know what you find, and empowering them and not just taking it on and saying, oh, let me find out for you. And helping them understand and helping them along the way so they know they can do those things and ask those questions. And then when they come back and say there isn't anything, okay, that sometimes happens, correct? So then is this something that we want to study? Is this something possible? I would say in particular, a goal for myself and for UH is to make nurse-led research not just more accessible, but less intimidating. Often nurses are intimidated, and easing that way and helping them understand the steps that they can take and participate in it, and making that as simple as possible for them, I hope will help them along the way. And having those mentors that can get them through the processes that are you can't simplify processes for IRB, right? But that being said, you can help them along the way and help them get to that point. And so I think that's really a nuance is I think that is one of the barriers, is it is intimidating to many nurses, and it scares them and they're not sure what to do and how to do it.
Great.
I echo what everybody said. We really tried here to encourage people to ask those why questions. Why are we doing it like this? Or why do you want us to do it like this? What is the evidence behind that? We instill the spirit of inquiry into our nurse resident program. They spend a day with the librarian. They do literature search around a question that they have based on what they've learned so far in their practice. And this year we've taken it even a step earlier, working with some of our nurse interns who are part-time nursing students and getting them involved in research. So a couple projects that we have going on, we've used them to do some data collection and help with that, so that gets them interested early on, and they can continue to be a champion for that too.
Great. Wow. Well, you're also supportive of the research enterprise. And I think these academic clinical partnerships are really key. I know we have a lot of students in every one of your sites doing either PhD, research or DNP, projects. So this infrastructure you're supporting, and then supporting the individual nurses and the culture that you're providing to have people ask why, is really a key in research and supporting sort of the Clinical Translational Science Collaborative's mission. Recently the CTSC was funded in July, and this round of the 7 years that they're funded, I think it's at a very large amount of about 59 million, but it's focusing on translational science, which is really a key for this academic practice partnership, because we're really focusing on that scientific and the operational principles that underlie each step of how we translate research into practice. Really like trying to learn more about what are the processes, what are the approaches that get us to better implementation of our research evidence into practice, removing the barriers and kind of speeding up that adoption of best practices into, the hospitals where you are. And then I know you are all reaching out to your community settings also, so that we can bring our treatments and what we know that works to more people more quickly. So this is really key. And I know you all also really support and value the inclusion of diversity. And that is another key component of the Clinical Translational Science Collaborative. So these environments and these resources that you all have to support this mission of our CTSC is really key. So I was wondering, maybe Elizabeth or Beth and Dean Musil, can you share maybe how the environments in which you work help to facilitate maybe this translational science with our nurses? And maybe we can start with Beth first, since Carol's been starting all along.
I like piggybacking off of Dean Musil though.
I
Yeah, so I think the environment here it's definitely facilitates translational science for nurses. We here support a lot of different methodologies for nurses. So, we're just talking about getting the application of research findings into practice, like through using EVP methodology, QI methodology, implementation science to study the process of how it gets in there. Like I mentioned before, we're really facilitating project culture here and trying to support nurses, giving them time to actually do things. And hopefully in the future, having larger projects that they can experience and help on. We also have a lot of programming, new nurse residency programs where they do a lot of these things, sort of like Holly was mentioning, and really giving nurses an opportunity to participate in any way that they would like to participate, even if they're just sort of like, trying it out. They're able to join like the Nursing Research Council or shared governance or an EVP council, et cetera, et cetera. So just getting them involved any way they can, I think just helps facilitate that process to get them more involved so that we can start looking at the processes.
Great. Thanks for sharing the VA's perspective. Carol, do you have some thoughts for the academic?
Yeah, sure. The thing about translational science is that it is really so broad. And so, for instance, we have some faculty who are doing research that I consider basic research, but I've been corrected and told that it's translational. So, for instance, we have one person who is looking at indicators of stroke at some, in lab kinds of studies, which apparently, according to some definitions, is translational. We have other people who are looking at, for instance, the role of sleep in families who are taking care of a child who is technology dependent, and how do you go about promoting sleep? So, I mean, it really runs the gamut. And all of those are important. And we haven't even begun to talk about those different kinds of projects that are being done in clinical settings to look at some of the more basic problems about processes and how to help patients.
Yeah,
But-
they have more.
Yeah, but going back to the question about diversity, one of the things that we have done last year is we have provided pilot funds for what is called CASH, and it is the Center for the Advancement of Clinical and Research Health Equity. And that's under the direction of Carolyn Harmon Still and Scott Moore, who are on our faculty. And it's to look at health equity across the spectrum of consideration. So it's gender equity, sexual orientation, as well as racial, ethnic, and other sorts of diversity. So, and being a part of the community. So, lots of different ways to tackle the problem.
Really great points. Thank you for sharing that news, the center there at the School of Nursing to promote equity. And then Holly and Meredith and Melissa, I know, so you're from the practice environment and you're more supportive to research, but can you share any activities that you are doing at your facilities or things you'd like to share?
Sure, I'll share a few things. Similar to what Beth shared, we have, focused symposiums or workshops on, what does it mean to look at evidence and look at the literature to find, adequate references, resources, and walking people through a process of how do you review appropriate evidence, which I think gets them into the mindset of then, can you move on to a quality improvement project? Can you move on to a full-blown research project? What does that look like for them? And also having the ability for them to apply for internal funding. I think that is helpful as well. Also, through our philanthropy, we have a Catalyst program that allows teams to apply for funding if they want to pursue research projects as well. And the last activity that I would say that really got a lot of energy and enthusiasm and excitement. We changed the name. It used to be Sacred Cows, but we went away from Sacred Cows and changed it to Evidence Before Tradition. And the evidence before tradition was really looking at why do we do certain things, and to, I think what Holly said before, like what does the evidence really tell us to do? And so are we doing something just because we did it? And so really kind of small bursts of, I'm looking at the list. Auscultating lung sounds an accurate way to determine if a ventilated patient needs to be suctioned. A Foley catheter if the urine output is initially placing the catheter, when initially placing it. Just kind of simple, small bursts of them having to recognize these are things we've just always done. Is there any evidence to support why we're doing it, or should we be changing practice based on,
Nice.
So those are, and all the questions came from our clinical nurses saying, why do we do this? So let's find out.
Right. That's great. It's sort of like the spirit of inquiry. And the simple solutions really make the biggest impact. It's neat. Holly?
Well, first of all, I love Meredith, the evidence before tradition. I wrote that down so I won't forget it. That's definitely a keeper. And so I'd have to say is I think in adding to what Meredith said is it's not just in our clinical environment saying, the sacred cows. It's all areas of nursing. It's in the administrative side, it's in the education side, it's in our leadership practices. And why are we doing these steps? What was the reason? Is it because we've always done it this way? Or, oh, it was it's a regulatory requirement. We look it up. No, it's not. Maybe it was 20 years ago. I don't know. So I think we always have to keep challenging it, not just at the bedside, but quite frankly, all layers of nursing. In regards to the research side and what some of the things we're doing, I would add in is we do an annual UH Nursing Research and Innovation Conference. And we just completed our 3rd year. We usually have several hundred to join it. And it seems to get a lot of energy and attention. And so that is one thing we enjoy doing and think that does give a highlight to nursing research. The second thing, I think we're right now at the point of really trying to set up those foundational education classes for our nurses and others that can, so then they know what to do in the research process and so on. So that's really where we're at this point in time.
Great. I love how you've combined the innovation, with the research, because it's a real important component of it is sort of thinking and creating and designing and prototyping before the thick of the research comes in. So it's great. How about you, Melissa?
We've tried to embed it throughout our practice here at Metro across the nursing enterprise. We have a career development program where we have evidence-based practice champions and research champions for those staff that are interested in that. And we provide some education to them on the front end and support to help them complete their projects. And then they get some monetary incentive along the way for completing them. This year, we're kind of taking it back to the basics and doing road shows about the different tracks of the professional development program and promoting that and sharing what that's about. So if you had a clinical question, how would you even go about starting to tackle that question? We have a Knowledge and Innovation Council that oversees our research projects and looks at some of the questions that have come up. What can we research? What might really be evidence-based practice, et cetera. And then we also have a Knowledge and Innovation Day during Nurses Week every year. And then this past year, we've really been working on promoting our evidence-based practice projects and our QI projects throughout the year, sharing those successes with the rest of the organization. So we tend to do those in a little bit in silos, like on a unit or a clinic. And then that doesn't really get shared out so that another clinic or unit can change those processes or change how they're managing a certain type of patient population. So now we share those at our shared governance general session days every month.
That's great. Wow. Well, thank you all for sharing your ideas and strategies for the translation of research into practice, both from the practice perspective and the research perspective. It sounds like you all are doing some amazing things in order to accelerate our translation into practice. And so thanks for sharing that. We have about 10 minutes left. I was just going to open up to anybody who's here in the audience. Maybe you have some questions that you've been thinking about, or maybe you've been inspired to ask. Open mic. Oh, there we go. Yes.
So of course, hi, everybody. Great conversation. The one thing, though, that I didn't hear is I never heard the word policy spoken by anybody. And of course, that's going to come from me, especially when we think about the Institute of Medicine in 2010 called on us to really be engaged. And we can do all these wonderful things through research and evidence-based practice, but if the policy doesn't back it up, then it's not going to be sustainable. And we know bedside nurses are so afraid of all this. We've had a couple of DNP students recently do some great work on political astuteness of nurses and how horrible they were. And I don't know if anybody saw Jimmy Kimmel last night or this past week, where he was asking people on the street knowledge of civics and how they couldn't answer anything right. And sadly, our nursing students and nurses fall in that same category. So if you could have a magical wand, what would you do to help us improve where we're at with our nurses and ourselves to really be more impactful in nursing in a policy arena? And it probably does require a magical wand.
Well, Becky, I always have had a deep passion for it. If I had my ideal state, my magic wand, it's what I would do all the time as a full-time job of trying to be embracing or getting nurses to embrace policy and being advocates in the health policy world. We had some early success many years ago of establishing a legislative and health policy council that really served as an educational forum for nurses to get active. And we pulled different, anybody who just wanted to learn more, wanted to be educated. We also did didn't even realize we unearthed nurses who were active in associations and were already taking that advocacy to the next step. We have reinvigorated that work. We brought it back. And so partnering with our government relations and having all of our nurses understand, again, kind of starting from scratch a little bit again, but the whole, who are your legislators at your state level? Who are they? Who's your city council? How do they vote? Who's representing you at the federal level? We just kind of kicked off and council again, and we had over 275 nurses attend the first virtual meeting. And so clearly people are interested and want to know more. I think we'll be at the knowledge stage again of educating and teaching. And one of the first activities we always do is, who your legislators are at the state and federal level, and if they vote and how they vote. And so that's what we send them away with their homework. And so hopefully we'll report back in a couple of weeks when we reconvene again. So I think that's the first step. And then just, we'll take it from there. So the magic wand is just kind of getting, re-energized there as well. But it's so important, and I don't think nurses realize the impact they can have. And us telling stories to other nurses how we've impacted, I think, is pretty important. Legislators want to hear the nurses' stories firsthand around how it's affecting patients and how it's affecting communities. And we have those stories to tell. And so we also need to have nurses be able to articulate those stories.
The power of nurses to move policy, right? Anybody else have any thoughts on the policy?
Yeah, I do. I think it also speaks to the importance of the different organizations that are associated with nursing. The ANA, the Academy, NLN, AOLN. I mean, any of those organizations really pay attention to what's happening on the policy front, what are bills that are being developed, and provide opportunities for us to give input that we can provide direct comment on. It's critical for there, and there are a lot of things that are coming forward that are not necessarily that are intended to be helpful to nurses that actually may not be because of the nuance. There's a real emphasis right now in finding ways to support nurses, but not all of those bills that are coming forward actually capture the best interest of the majority of nurses or of the discipline or the profession. So it's very important that nurses be connected to join some of these nursing organizations and to become literate in terms of information, what's happening, not just in nursing, but on the national scene. This is something I'm very concerned about in 2024. And so it's really important that people are well educated and well versed.
I wanted to add to that. That was one of my points as well, is we need to have more nurses joining our professional organizations that lobby for us. That is our voice. But secondly, my magic wand, we have more nurses in legislative positions. If you compare us to our physician counterparts, we're woefully underrepresented at the federal level, state level, local levels. And so there's such an opportunity for nurses to be in office and have that voice. And I think we should be there. And so that would be my magic wand.
I agree. I think, as clinical leaders, it's up to us to put an emphasis on that. I can see in the past, that wasn't discussed much here at my organization. Government relations was always going to the physicians, even interestingly enough, about issues related to nursing. So I made it a point to have a good relationship with our government relations VP and to continue to enhance my knowledge about advocacy. So we had Dr. Patton come in and speak to our nursing leaders a couple different times over the past year. I am currently president of the Ohio Organization for Nursing Leadership. We have a very active legislative and practice committee. So I've encouraged some of my nurses to join that committee. And I also bring back information to our Chief Nursing Executive Council, and also again at that shared governance general session, about what is going on out there, so that it helps keep our staff informed, helps them think a little bit differently about different bills that are out there. As Dean Musil said, there's a lot of interest in helping support nurses. But it's other people kind of looking in from the outside, trying to say what can help us. And it's not always helpful. You know, staffing ratio bills, for example, mean very well, but if we don't have the nurses, that doesn't help us. So we have to take a step back from that and build support and advocate for what are those other resources that we need so that we can get to those ratios or get to that level, but with leadership and advocacy from ourselves.
Right, great. Well, I'm glad we brought the policy issue in because policy is a driver for change. And as scientists and as academicians and practicing nurses, it's important that we all are all involved. It looks like we're running a little short on time, but could maybe just each of you share in about 20 seconds or so, like how can we strengthen our academic practice partnerships for research, the engine, and to support the new initiative to get evidence into practice? We'll start with Carol. Any thoughts on academic practice partnerships or the future of what we can do next?
I think in terms of those partnerships, I think there's a lot that we can do to build bridges. I think an opportunity like this is really important for us to hear each other and the kind of work that each other's doing, and we probably should be doing this more often.
Great. Anybody else like to comment on that?
I think the ongoing collaboration and dialogue. What do we need from each other? So in the practice field, we might need a little more help around that research side. And for the academic side, they might have needs to have a site for a study or partners. So continuing that dialogue, looking to what are the needs of our nursing profession. Where can we align interests? So for example, Mary and I have been actually working this past year around training nurses to work in the community setting. Undergraduate nurses coming out of school being prepared to go into that community setting. So doing some work around that and identifying best ways to prepare our nurses for that future.
And Meredith, did you have a thought?
Yeah, I was just going to add, I think we have to have ways to make it just as part of the expectations of professional nurses. So kind of separating away from it being a, you know, this is my job and this is what I do outside of it, but it's kind of part all of our professional expectations. I think we can glean from our physician colleagues, you know, they're providing patient care and then they're also faculty and they're also doing, you know, research projects. And so how do we make it kind of this all encompassing as an expectation of the professional nurse? And it's not just about going to get another degree or, you know, adding more letters, but that how do you just make it more inclusive of the professional expectations as nurses?
Great. I'm sorry, I think we're out of time. So this ends our time together, and heartfelt thanks to you, our amazing nurse leaders who are really role modeling these characteristics to ensure that our world's a better place and that nursing is working forward and leading in research and in practice. And thank you to the CTSC, Jaleesa and Zena, for hosting this series during Women's History Month and for highlighting nurses. We are grateful. So, and thank you to all who have come to this to take a little time out to think about your nursing career, how you align with research. And I know we're all busy, and it's a great day to celebrate our leading ladies in nursing. So thank you again to all.